Hi, this is Shaayan on Fever 104 FM. You are tuned into the Superhero Show, and this is Surgeon on Air, brought to you by Sironix, arthroscopy division of Healthium. We've got Dr. Chirag Thonse with me. Sir, thank you so much for coming to our studio. If you could kindly introduce yourself for our listeners, please.
Yeah, hi Shaayan. Myself, Dr. Chirag Thonse. I'm the lead orthopedic surgeon, Manipal Hospital, Millers Road, and director for the Orthopedic Clinic, Cooke.
All right. Now, before we began the conversation, I asked you that you specialize in knee and shoulder. Those are the two areas that you do specialize in. Let's straight away dive into the topics. Joint pain, what does that signify?
Joint pain is something which all of us do experience at certain point of our time.
Right.
Since I'm talking to you, Shaayan, you seem to be in your mid-30s. So I would probably talk about knee pains in your age group.
Okay.
We are talking about young guys who are having knee pains. That would be more relevant. Younger guys can come with knee pains because of different issues. Either it could be an impact, like an injury, sports-related injury, or else it could be an overuse pain. So we deal with two spectrum of patients. One is the injury-related pain, which can be either cartilage damage, a ligament injury, a cushion injury into the knee joint, or it could be a natural wear and tear, or overuse, or abuse, or age-related wear and tear. So both of these spectrum of patients do come to us with knee pain.
We're talking about cartilage wearing off. Does that happen through wear and tear, or does that happen because of over usage? Because I have I have some dancer friends and also they have complaints about knee pain. So I'm just trying to understand that part.
Yeah, so let me put it in a nutshell. Now, a cartilage wear and tear basically means arthritis.
Oh, okay.
Or else, if you put it this way, any inflammation or pain in the joint is called as an arthritis.
Okay.
Now, there are various forms of arthritis. Arthritis could be systemic, in the sense blood related, which is like a rheumatoid arthritis. One could have gouty arthritis because of elevated uric acid problems. Or one could have a natural wear and tear of the cartilage, which is called as the osteoarthritis. So by and large, what you are talking about is an overuse or an abuse, and that is a natural wear and tear, which is called the osteoarthritis, which is a pandemic in today's world.
Okay. All right. What are the risk factors of anybody getting arthritis, for that matter?
Primary, lifestyle, weight, hereditary, activities. So it's a confluence. It's a mixture of or a combination of a lot of factors which predisposes individual into arthritis. So basically, if somebody is on a heavier side, there's a lot of load on the knee joint, and that load can cause early wear and tear. If somebody has a strong family history of wear and tear in the family, that a person is naturally prone for having early arthritis. Somebody is a vivid athlete who is reckless about their joints, not taking care of them, doing activities which are stressful to the joint. This can also prematurely lead to a wear and tear of the joint and can lead to an arthritis.
Okay. How does one who is not experiencing any kind of pains as yet and is into their mid-30s or whatever, even earlier, how do they take care of their joints, for that matter?
It's as simple as that. Lifestyle. As I said, one of the most important or the key factors in preserving the joint is your lifestyle. Avoid loading activities, in excess. Somebody, of course, my cardiology friends do tell that you need to take stairs. That's not wrong. But we need to know, take stairs in moderation, not overtly abuse that. Activities which predispose to early wear and tear, like repeated squatting, repeated lunges, which is beyond one's capacity, impact activities like kneeling down, playing any kind of sports which is not the individual is not toned to, or is neglecting small injuries. You have a twisting injury into the knee joint, you have a small niggle and pain. I think these are warning signs which needs to be recognized early and needs to be treated or catered to. A slightest discomfort or ache, assuming a person has difficulty in standing, walking, climbing stairs, squatting, getting up from sitting position. These are early signs of your joint damage, and one needs to pay attention to that. In case if it is not resolving with the rest and modification of activities, seek in with the help of a doctor.
All right. You brought up the fact of people ignoring, the small pains and niggles. We will talk a little more about that later on in the interview. But if you could tell us a little bit about what are the stages of arthritis and How do we recognize them? I mean, you did say that, these small pains and niggles, but how do we recognize and what are the stages of arthritis?
Yeah, arthritis can be, you can stage arthritis into 4 stages, right from early stage to a delayed stage of arthritis. I'm not going to go into the academic part of it. In a layman term, if I would put, earliest symptom of an arthritis is when you have occasional aches and pains in the joint. If you have pains on a regular basis, which is not affecting your activities, it is stage 2. In a stage 3, you have pain on a day-to-day activities. You have pain which is affecting your lifestyle, that is stage 3. And when you have serious problems, it's a stage 4.
Okay.
I just made it simple for one to understand when they need to seek in from a help with the doctor.
But the point is the stage 1 pain that you mentioned, when it's occasional and it is, it's not stopping you from doing. Anybody who does a little bit of activity will always have this small aches and niggles somewhere. But, it goes away with time. So how do you differentiate between them?
Yeah, so if you have a constant pain which is persisting more than 3 weeks, then it's something which you need to take seriously. Okay. And of course, one also needs to consider your age. I mean, you wouldn't expect a wear and tear before 40 years.
Right.
40 is when you start getting aches and pains in the body, either because of natural wear and tear or your body composition which changes. So any individuals who is in their late 30s, early 40s, who has got a constant pain on activity or off activity for a period of 2 to 3 weeks time, that's when you need to take things seriously.
All right, we did talk a little bit about how to identify arthritis, what causes it, and how to prevent it. But what are the treatment options for arthritis? Can we talk about that now?
See, treatment options for arthritis are many. You have surgical treatments, you have non-surgical treatments. I'm not going to talk about the surgical treatments.
Let's talk about, if it's an early stage, like, first, second, maybe. So how do you treat that then?
So early stages of arthritis are always treated conservatively. Of course, lifestyle modification, weight reduction, all this goes without saying. But of course, there are certain modalities in today's world which are frequent in our practice, which helps to improve the quality of life, which helps to improve the quality of your cartilage, which gives more longevity. Like in the commonest modality right now, me as a knee and shoulder specialist,
right.
I have a lot of minimal invasive procedures like injections into the knee joint, may be regenerative injections, like like what we call about what we talk about PRP, platelet rich plasma, or else a gel injection into the knee joint, which gives you more volume into the knee joint and cushions your knee joint. These are the simplest and the best modality of treatment for early arthritis in today's date.
All right, you did bring up PRP, which is platelet rich plasma. Can you elaborate a little bit on that? What is that actually?
Yes. It's worthwhile knowing what exactly PRP is. I mean, PRP is used for various causes. It's basically regeneration of tissue. Platelet-rich plasma helps you to regenerate certain tissues. Dermatologists use it for skin regeneration. We orthopedicians use it for joint regeneration. Now, a platelet-rich plasma is nothing else but drawing your own blood. That's about 30 ml of blood, and centrifuging it at certain speed, and the sediments which is got out of it, maybe 2 ml, which is highly rich in your platelet-rich plasma. I mean, platelet-rich sediment, which is called the platelet-rich plasma. This is injected into your joint to probably, one is to reduce the inflammation, reduce the pain, and at the same time enhance the regeneration of your joint cartilage, basically. If I were to elaborate on this a little more, you have 2 kinds of PRP. One is the leukocyte rich and one is the leukocyte depleted. Okay. And both of them have got various benefits of them. Earlier days, if you would centrifuge PRP of 15 ml, you would get 1 ml sediment with about 2.5 lakh cells which are productive. But in today's date, we have certain technologies and certain commercially available products which bring in up to 22 lakh cells, and that is quite an fantastic things to be used.
All right. I thought centrifuges has mostly got to do with nuclear power, apparently with PRP as well. Okay, gel injections, another thing that you brought up. Gel injections into the knee, do they help delay the progress of arthritis? How do they help?
Yeah, basically it replenishes your synovial fluid. we all know that there's certain amount of fluid in the knee joint which acts like a cushion between the two bones or the two cartilages. So when you have arthritis, you have the synovial fluid which is depleted in the joint, hence causing friction into the joint and wear and tear of the joint cartilage. So what a gel injection, basically it is sodium hyaluronate. It's just a volume which fills up the space between your two bones.
Okay.
These sodium hyaluronate gels gives you a cushioning, it gives you lubrication, increases the mobility and reduces the pain.
But does it have to be, done repeatedly? Does it go off after some time, or?
Yeah, you have gel injections of various viscosity,
Okay.
and each one of them have different properties. On what we usually use is moderate viscosity gels, and these gels usually last for about 18 months, and probably maybe it can be repeated after 18 months.
All right. We were talking about different treatment options of, for arthritis. Surgery is, of course, one of them. Is surgery, kind of always required for arthritis? What would you say?
Yes, of course. That's a very interesting topic. But let me just put one more point before I get into this. Since we spoke about PRP and since we spoke about gel injections, we have a combination. Why don't you put 1 + 1 together?
All right, so you can combine both.
Yes, and have a double effect. So we spoke about PRP being a regenerative medicine, in the sense it helps you regenerate your cartilage. At the same time, the gel injections prevents the wear and tear or from further degrading. Now, if you have both of them in a single injection, it gives you double power and double strength. So that's a challenging technology which is now introduced into the market, and there is a combination of PRP and HA right now available commercially, and it's seen to be a challenging modality of treatment for early stages of osteoarthritis.
So this PRP and gel combination, or
Yes.
HA as you mentioned, is it specifically used only for, let's say, your knee area, or it can be used in most joints in the body?
Yeah, by and large it is used for the knee, but it can be used in your hip joint, it can be used in an ankle joint, it can be used in your shoulder joint.
Yes, we will come to that surgery part. Is surgery always required to treat arthritis?
See, I'm basically a surgeon, so I like to incline towards surgical interventions because we see benefits of surgery. At the same time, we should justify the treatment. There are certain situations where surgery becomes inevitable. Assuming a patient comes to us in a grade 4 or a stage 4 of arthritis with the deformity, severely damaged joint, of course surgery is mandatory for such individuals. If it is a moderate arthritis or if it is early stages of arthritis, surgery is not indicated there. We have to deplete our non-surgical options, then only go in for a surgical intervention. So there comes the role of conservative treatment, in the sense there comes lifestyle modification, there comes physiotherapy exercises, strengthening of the muscles, and then comes the gel injections into the knee joint, then comes your PRP injection for regeneration, and of course if all of them do fail, then we go in for a surgical intervention.
All right, you're a busy man. I wouldn't keep you in the studio for too long, but if anybody who's listening to this interview or watching it online, if there is somebody who's, listening to all of this and thinking that there are these small aches and pains that I have, maybe in my joint, maybe knee, shoulder, whatever, and I am ignoring it, thinking, zindagi to chal rahi hai. It's not stopping me from doing anything. So what is your message to them?
My message to all my patients is the same. I mean, do not ignore pain. Pain is not a part of your life. Pain is just a baggage, and you need to get rid of the excess baggage what you have. So we have plenty of hospitals, we have plenty of doctors. Bangalore is a city of medical hub. I think one should avail the facilities which are available in today's world and get going with their routine rather than suffer with pain.
All right, pain is a baggage. It's not a part of life. I think we all, assume that pains and aches are there for everybody, and everybody goes through it. It's just a part of life. Dr. Chirag says it is not. Go ahead. We've got lovely doctors here in the city of Bangalore, in India, like Dr. Chirag Thonse, and he can definitely help you with any pains and aches you have, especially in your knee and shoulder. Dr. Chirag Thonse, thank you so much for being in the studio, and thank you so much for enlightening us with all this chit-chat.
Thanks, Shaayan. Thank you.
Fever FM.